What's up, everyone? Trying something different. For those of you that have been following me on the internets for a while or have been part of my YouTube channel, I'm deciding to land over here on YouTube. I do a video series called Hey Sean. It's where I field questions from the tribe, and they usually start the question with the words, Hey Sean. I answer anything and everything that nurses have on their mind. And I've been posting them here and there on YouTube as well as my other social channels, and decided, video, YouTube Live, why don't we try it on YouTube Live? So here goes nothing. Today's Hey Sean question is about negativity and bullying in nursing. A nurse from the tribe asked me, how do I handle the negativity? And I had another nurse ask me about the bullying or the passive aggressiveness. I believe that all of this can be lumped into one category, which is bullying, or what we nurses have coined as nurses eating their young. This is not a new concept. This is unfortunately still running very rampant in our profession. And sadly, I don't think it's going away anytime. We got a couple people jumping into the live feeds. I want to say hello to Matt and everyone else that's hanging out with me on the live feed. Thanks for joining me. Talking about negativity and bullying in nursing and how I handle all of it. For those of you that are new to this, who have never seen me before, or are just joining for the first time, I have been a nurse and in the profession of nursing for almost 15 years. I am an acute care nurse practitioner in a level 2 suburban urban teaching hospital. I work in a critical care department providing critical care services to the critically ill. Big surprise. I've been an ICU nurse my whole entire career, and nursing is my third career. So, talking about negativity and bullying, why nurses eat their young. There's a bazillion reasons why. The bottom line is you should accept the fact that it is going to find you in your profession. I don't care where you work. I don't care how old you are. I don't care how long you've been doing this job. Negativity and bullying is going to come across your screen and land in your lap no matter what you do in this profession. Because the negativity and the bullying happen not only from your colleagues, but can happen from your patients, their families, their friends, visitors, as well as anybody that you work with, up to and including your physician partners. So, three things that I do to combat and what I call extinguish bullying. Number one, the first thing is you need to make sure that you don't allow it. What you allow will continue. If you simply ignore it or hope that it goes away, it will only fester like a nasty blister. That's quite a horrible analogy, but you get the point. You cannot ignore it. You cannot hope for it to disappear. And you cannot expect somebody else to take care of it, especially when it gets slapped in your face. Gail says she plans on being in the ICU when she graduates. Strong work, sister. Love the ICU, obviously. First thing you do to combat bullying and negativity is that you need to make sure that you do not allow it. You need to make sure that you address it in some way. I don't care how you address it. I don't care what you decide to do about it. But you better do something about it. Do not passively expect it to disappear. And don't go wallowing in the corner because you feel that you're getting ganged up on. It's time to put on your big girl and big boy panties and start dealing with this crap. Number 2, the second thing you can do when it comes to dealing with negativity and the bullying is to attack it head on. You need to make sure you attack it head on. You attack it head on. Don't expect your manager, don't expect your seasoned nurses, don't expect somebody other than yourself to figure this out. You need to make sure you address whoever the person is that is feeding you the negativity or giving you the bullying. Now remember, bullying is both passive and active. There's these concepts out there called, it's escaping my brain right now, but there's active and passive bullying. The passive aggressiveness is probably the most damaging and the most mind-altering, stressful part of bullying. Passive aggressiveness is horrible, and guess what? The passive aggressiveness is the most popular thing out there. So deal with it head on, and make sure you try and deal with it in the moment if you can. Obviously, I would not recommend confronting your bully at the bedside. It's not appropriate to do that in front of your patients, your family members, or anything like that. But you need to attack it head on and deal with it ASAP before the shift is over. Do not wait the weekend out. Do not wait for things to calm down or for people's attitudes to get better. You need to make sure that you deal with this BS up front and center while it happens. If you have to, you step aside, you pull them aside into the break room or go take a walk. You need to make sure you actively recognize it and tell them, hey, listen, I don't know if you realize this or not, but you're being very negative. Or, hey, I don't know if you realize this or not, but yeah, you're making me feel a little uncomfortable. You're making me feel like you're trying to bully me. And you can use the word bully, because many times people are going to be shocked that, one, their actions are causing that, and two, most people don't like being called out on the carpet. The last thing, number 3, the way that I deal with bullying and negativity is that I recruit help. And I recruit help from all walks of life, whether that be from other patients, other family members, friends, visitors, my equal colleagues who are in the same boat as me, people that have the same amount of experience as me. I will recruit someone who is fresh, out of school, green behind the ears, doesn't even know how to handle a syringe to help me. And I will also, of course, find the seasoned veterans as well as my managers and my physician partners to help me when it comes to dealing with bullies. I'm not saying you need to gather the troops and try and gang up on somebody, but you need to have support. You need to make sure that not only this isn't just your interpretation, but that you have somebody else helping you out. Heather saying, thanks for the feed, second semester. Sorry, Heather. I'm still trying to figure out how to manage these YouTube live videos. They don't let you deal with the comment here. Let me see if I can see all the comments. Oh, there we go. Look at that. So Ariana says hello, Gail, Heidi, and then healthy, wealthy, and stealthy. Now that's I'm liking that one. So she's a second semester, he or she, sorry, studying CCR and stuff. Huge inspiration. Oh well, thank you. Apparently I can be inspiring sometimes. To review, 3 things that I do to battle negativity and bullying. Number 1, don't allow it in the first place. Don't passively let it happen. Do something about it. Number 2, you need to make sure that you actively engage with that person in the moment or as soon as possible. You need to engage and confront them. You need to put on your big girl and big boy pants on and start dealing with this crap face first. And number 3, if I can do it, 3. Number 3, you want to make sure that you recruit help when needed. Even if you're just recruiting help, to make sure that you're rationalizing and that you're approaching this in a professional manner. Let me say that again. Professional manner. We all graduated high school. This is not about he said, she said, finger pointing. This is not about who's right and wrong. This is about treating others like you want to be treated, and make sure you maintain professionalism in this profession we call nursing. I want to thank those who hung out with me on the live feed. For those of you that are just checking this out on the record, please make sure you like this and or comment and let me know what you do to battle negativity and bullying. Of course I want to hear from you. Send me a message, leave me a comment. Oh, and as I'm doing this live on my front porch, I have a wonderful fly trying to join us. Please make sure that you subscribe to my channel. Make sure that you leave me a comment and say hello. Thanks for hanging out with me. And as always, check your own pulse first.